So the debate over whether to tax sugary drinks has grown louder, with concerns growing that the combination of those kinds of drinks and the drop in physical activity during the pandemic is contributing to serious health issues. But state lawmakers have banned local soda taxes for another 10 years. Critics say that's another sign of the power of the soda industry. They point to overconsumption of sugary drinks, leaving people with higher rates of obesity, heart disease, type 2 diabetes, and tooth decay. To talk about why some believe a soda tax would help is family medicine practitioner Dr. Melissa Campos. Welcome.
Hi, thank you. Thanks for having me.
So what types of drinks are you proposing be taxed, by how much, and who would pay that?
So sugar-sweetened beverages can include soda, juice drinks, energy drinks, and then anything that contains sugar. So even coffee and tea contain sugar. So that would be some of the drinks that we would be looking at.
And how much would you tax those, and then who would end up paying that?
So what we're hoping to have is to have the community decide that if we want to have a tax, how much it is, and then that revenue will go towards the community to looking at helping the community with pre-K programs, health improvement programs, job training, whatever the community feels that they need.
Is there evidence that so-called soda taxes really work to help people be healthier?
There is actually in other cities where it's been enacted, it has helped. Philadelphia, San Francisco, Seattle, and the Navajo Nation have sugar drink taxes, and the research has showed that sugar drink purchases have decreased, and the tax revenue has been used to support community programs.
Now, some argue that this would not help if families and others continue to make sugary drinks available to kids. How would you address that?
I guess that about being an individual choice or something, but I would say that the reason we have obesity, overweight children is because of systemic health disparities, inequities. And I don't think that taxing, that this tax would negatively impact the communities. People can still make individual decisions, but these programs will help support these communities where there's a lack of healthy choices, lack of green space, lack of community programs that will allow them to live better lives.
Given the state ban in place right now, how likely is it, do you think, that something like this could be passed soon? Have you had a chance to talk to any lawmakers?
We're working on that, and I want to encourage everyone to reach out to their local elected officials. We have wanted to support AB 1163 that would give communities local control and the option to vote to enact sugar drink taxes. So I really want to encourage everyone to reach out if this is something that they feel, we feel would help communities. So if you agree with us, please reach out to your local elected officials to support having the opportunity to even discuss this option. Because right now, you can't even discuss it.
Now, you mentioned a little bit of how the money would be used. Would there be a way to earmark it toward certain communities more than others, depending on which ones are having problems with this?
Yes, and I think that's really important. We have seen that communities of color, Black and brown communities, have been targeted by big soda and sugar drinks. And so I think by marking the money, if that's what the community feels is necessary, would really help these communities that don't have healthy options. You go out there and the cheap stuff is the sodas. Sometimes you don't have options of healthy food, fresh food, or healthy drinks. So this is something that we can do to help improve health inequities in these communities of great need.
Dr. Melissa Campos, thank you so much for spending some time with us to explain the issue.
Thank you for having me.